It's possible that you might have had a surgeon at the Weymouth Hospital in 1922 who had formal surgical training either in Boston or in another city. It's also equally possible that you had a primary care doctor who just happened to know how to take out an appendix or suture a laceration or reduce a fracture and did it. So the 1920 was a period of transition from surgery being sort of a trade that physicians picked up to a specialized profession. What was really required was the training to actually do an operation, how to conduct an operation safely, how to prepare a patient safely. A lot of it had to do with imaging. I mean, the hospital didn't even have an X-ray machine when it opened. They bought one for $1,500 the next year, in 1923. General anesthesia in 1920 was dripping ether into your face. Enough so you were asleep, but not enough so you stopped breathing. So we needed to have improvements in anesthesia. We needed the development of antibiotics, we needed the understanding of shock, and we needed surgeons who were technically able to accomplish the mission of removing something safely, not losing too much blood, and sewing things back together so that they didn't leak and didn't fall apart. One thing that we have in room 6 in our operating suite now is the ability for our vascular surgeons to do a vascular operation entirely through a small entrance into a vessel and negotiating a wire into basically any artery in the body that you want to, putting a stent in or a graft, or in some cases, if the artery is bleeding, to put some material in to clot the artery off. And I'm sure if Dr. Emerson could watch any one of our surgeons either stapling together 2 pieces of intestine or sewing them together, he'd be amazed. You know, they didn't have a lot that they could offer patients back then, but what they could offer them was a bed. So they let them have it for a pretty long time. In the 100 years since then, we've learned that people are much better off if they get up, if they can, and they walk around. We do the surgery in the hospital, but we send them home as early as possible, often on the day of surgery. And we now have mobile integrated health that can keep people at home, even if they would otherwise be hospitalizable.